Let's talk about hyperparathyroidism. So this word means too much of or excess of, and parathyroid is the gland behind our thyroid. So hyperparathyroidism is an excess production of parathyroid hormone produced by our parathyroid gland. So what is the epidemiology of hyperparathyroidism? Well, it is more likely in women, in fact 2 to 3 times more likely to occur in women than in men, especially after the age of 55 or after menopause. Third most common endocrine disorder, and 80% of patients don't actually show symptoms. So anatomically, 4 small parathyroid glands are attached to the posterior portion of the thyroid gland. In normal physiology, parathyroid gland cells work to regulate blood calcium levels by releasing parathyroid hormone when low blood calcium levels are detected. The bone responds to parathyroid hormone by having these osteoclast cells on the bone breaking down the bone, therefore releasing calcium from the bone into the bloodstream. Kidneys respond to parathyroid hormone by increasing calcium ion resorption. This all helps with proper muscle and neural functioning and blood clotting. So there are 2 types of hyperparathyroidism. There is primary and secondary. So primary can be caused by a tumor or genes. Rarely people inherit a gene that affects function of the parathyroid gland and parathyroid hormone. It's mostly a tumor, but in this case we see an excess of calcium in the bloodstream because parathyroid hormone is being released even though there's an adequate or excess amount of calcium in the blood already. So this can result in brittle bones since it is constantly being remodeled to release the calcium in the bloodstream. And because we use calcium in our central nervous system, this can also affect our concentration and cause poor concentration, fatigue, neuropathies. It can cause constipation, muscle weakness, kidney stones, and overall pain. There is also secondary hyperparathyroidism, and this is where there's too much parathyroid hormone secondary to a condition someone is already experiencing. It's the overcompensation of the parathyroid gland to levels of low calcium. So in this case, we see a low level of calcium, and this can be caused by kidney failure, low vitamin D, because vitamin D helps absorb calcium, or just low calcium in the diet. So with primary, we see a high level of calcium in the blood, and with secondary, we see a low level of calcium in the blood. So hyperparathyroidism is an excess production of parathyroid hormone in the bloodstream. This can be treated with, if it's primary hyperparathyroidism, then we have to surgically remove the parathyroid. And if it's secondary hyperparathyroidism, then we can prescribe or recommend calcium supplements. If not treated, people with hyperparathyroidism have an decreased lifespan of 5 to 6 years.